Good morning, everyone, and welcome to my oral presentation. Evaluation of villager views of Opisthorchis viverrini infection control over the past 20 years in rural area, Thailand, a mixed method study. First of all, let me thank you all for coming here today. Next, I would like to give you an overview of background and rationale. Opisthorchis viverrini, a liver fluke, poses significant public health challenges in rural Thailand, especially in regions with raw or undercooked fish consumption. Chronic opisthorchis infection is linked to hepatobiliary disease, including cholangiocarcinoma. Despite efforts like health education and sanitation improvements, the long-term effectiveness of control measures remains uncertain. Next, I will focus on the graph. The graph illustrates a 20-year trend in the incidence of Opisthorchis viverrini infection in Naya village in Chachoengsao province. Province expressed as case per 100% years. 2002-2010, the incidence remained relatively stable with minor fluctuations. A significant decline in incidence was observed, reaching its lowest at 2.1 cases per 100% year in 2020. I would like to discuss in more depth the implication of objective. First, to determine the incidence of Opisthorchis viverrini infection in the Naya village. Second, to determine the factor influencing the control of Opisthorchis viverrini infection in the Naya village area by using qualitative method. Study design. This study we use mixed method study. Quantitative method we use community-based retrospective cohort study with qualitative method focus group and in-depth interview. Study participants in quantitative method. 264 Naya villagers who test negative for Opisthorchis viverrini infection as baseline, 229 and positive 17. Study participants in qualitative method. 36 Naya villagers separate into focus group from people who know each other and people with age more than 50 years old and in-depth interview 3 persons. Data collection in qualitative method. First, we send the blank container to villager and receive from the post. And then we use the sample to measure incidence of Opisthorchis viverrini infection in the lab. Second, Google Form asks the villager about some demographic data and risk factor. For example, how they prepare the food raw or ripe. Data collection in qualitative method. We ask villagers about what is opisthorchis, how 20 years Phramongkutklao College of Medicine intervention impact on opisthorchis viverrini infection, how community impact on opisthorchis viverrini infection in focus group and in-depth interview. Data analysis in qualitative, we use data program, and in qualitative, after we record script from villager and code it, then we use thematic analysis. Quantitative analysis. Incidence density of Opisthorchis viverrini infection in 2024 is increased to 6.4 from 2.1. We found that koi pla and rap pradip consumption has a significant impact on incidence and risk factor of Opisthorchis viverrini infection. In qualitative analysis, we describe into 5 themes. 1. Perceived threat. 2. Perceived benefit. Provides Phramongkutklao College of Medicine intervention. 3. Other factors that cause decreasing in Opisthorchis viverrini infection rate in this community. 4. Efficient access to information leads to a decrease in Opisthorchis viverrini infection rates. 5. Reasons why there are still cases of Opisthorchis viverrini infection in the community. This is an example of perceived benefit toward Phramongkutklao College of Medicine intervention. Stool collection is wonderful since it does not hurt like blood collection. Person D4 focus group D said. If Phramongkutklao doctor hadn't come, many people in Nayao would have died. So have I. I would probably have died a long time ago. Person G1 focus group D said. The Phramongkutklao doctor comes every year, so trust them. More than those who don't come occasionally, person A4 focus group A said. And the reasons why there are still cases of Opisthorchis viverrini infection in Naya village. I would rather die than not eat it, person A2 focus group A said. And maybe the fire element in the body kills the river fluke. Person B2 focus group B said. And then I would like to raise briefly two qualitative information to explain dynamic of Opisthorchis viverrini infection. The results from qualitative studies show that increasing in awareness, medication works well, proactive information from Phramongkutklao doctor, younger generation is less fish, impact on decreasing of incidence of Opisthorchis viverrini infection. And deeply rooted local Northeastern cultural traditions, misunderstanding of Opisthorchis viverrini infection, misunderstanding about alcohol killing parasites, inviting from intimate to eat raw fish, alcohol stimulating the desire, impact on the increasing incidence of Opisthorchis viverrini infection. Finally, for 20 years, Phramongkutklao College of Medicine has implemented continuously intervention to literature on infection risks and promote behavioral change. So the incidence density from the 20 years is decreased from around 20 to around 5. Because of this success, we think this could be an example of control model for Opisthorchis viverrini infection at community level. In further development, effective management of Opisthorchis viverrini infection requires a combination of cultural understanding, community leadership, and innovative intervention. By addressing traditional practices and fostering community engagement, we can pave the way for more sustainable health outcomes. And we would like to thank you, our advisor, and our team and reference. Thank you for all your attention.
Congratulations. The the very interesting point is the increasing incidence last from the last follow-up from 2.1 to 6.4. Um, do you, do you have any chance to look at the trend of those people who still consume koi pla? Is this a decreasing trend or is also increased between the last and the current survey? The proportion of those who, who still consume koi pla.
In qualitative method,
I mean, in quantitative.
quantitative.
Yes.
In quantitative method, we observe from Google Form and stool collection and about what food they eat. We found that koi pla and lapradip is consumed uh, decreasing in 20 years, but lapradip is more increasing and koi pla is decreasing. So the next further research should be more attention to lapradip.
Since you mentioned in your title as the evaluation, right, of the OV control over 20 years, do you mind exploring, describing the intervention that Phramongkutklao did it in that? Thank you.
From the first 2021 to 4 to 20 to 6 to 4, we use diagnostic case and treat intervention. So it's the conventional intervention. So it's stable to in decreasing graph curve. We use more knowledge, more mutual relationship with villager. We contact health provider or health uh, in the area. We connect more with villager and have some intervention like hygiene toilet uh, in the rural area, and for more knowledge they have gained, the more decreasing in koi pra and labradip consumption. Thank you.